Welcome to our conversation with Dr. Vivot Solemore, a renowned expert in general medicine. Today, with the change in seasons, we will be discussing in details about how we can cope with the change in seasons along with the various diseases or maybe health issues that arise with it. So, welcome viewers once again. Let's dive into the conversation and get meaningful insights from Dr. Vivot Solemore. Hi, sir. Thank you so much for your time once again. And can you briefly give an introduction of yourself to our
Hi,
viewers?
thank you for having me. My name is Dr. Vivot Solemore. I am a physician by practice. I am currently working in Oking Hospital, Kohima, as a physician.
Okay, thank you so much, sir. Sir, now moving on, as I gave an introduction that we will be discussing about the current season's health concerns on today's discussion. Can you let us know, what are the most common health issues you're seeing in patients during this season?
Yeah, currently with the monsoon season, especially since I'm in hilly areas, what we are facing mostly are waterborne
Yes.
issues. So in practice, what we see regularly are food poisoning,
Okay.
diarrhea, vomiting, and common infections as well, like respiratory infections, throat infections,
Okay.
and nose infections, and sinus problems. Yeah, so those are the common problems we are facing here. In the plain areas also, the similar issues are happening, and more waterborne illnesses compared to Kohima because of their the plain area and
Okay.
more presence of water logging also. Yeah.
Okay. And does that, specifically imply to any particular group of age of people or how? Or does it imply to majority of the people,
It
be it in
is,
hilly or the plain terrains?
yes, it is kind of implicated to all the populations also.
Okay.
Certain, of course, certain age groups are more vulnerable,
Okay.
the young ones
The young
and the
ones.
elderly, but
Okay.
the youth are also the one who are most out and about, so they're also equally vulnerable to the current problems. Yeah.
Okay. So now moving on to the next one. How do seasonal changes affect people with pre-existing medical conditions?
Yeah, it can, for pre-existing conditions in commonly in Nagaland, it will be diabetes, it will be hypertension,
Yes.
high BPs, and then it will be some lung issues because of their occupation or because of smoking. So we and heart failure as well because of prolonged BP and sugar problems. So monsoon per se, because of the dampness in the environment and because of the heat also, it can both worsen the pre-existing conditions. It can increase the risk for pneumonia infections. It can increase the risk for common infections in patients with diabetes or hypertension or kidney problems because their immunity are naturally slightly lower than the common people. And the heart failure patients with heart problems also, the change in the current season can worsen their existing symptoms. Yeah.
Okay. So now, also, what are some emerging health concerns specific to this season? Because just like you mentioned now, we already have a larger population of our Naga people with diabetes as well as blood pressure related problems. So, apart from those, what are some emerging health concerns specific to this monsoon season?
There are certain issues. One is, like I've mentioned earlier, waterborne issues. Commonly, diarrhea or food poisoning, so to say, because of contaminated water, and then mosquito-borne, or we say vector-borne illnesses because of insects or flies and all that. So malaria can increase, dengue can increase, and then some other virus infections, Japanese encephalitis, different infections can increase due to the accumulation of, so to say, artificial accumulation of water. So that is one. Another is for people in rural areas, there can be increased risk of animal or insect bites also. Snake bites can happen more commonly because there are more grasses, poor visibility, and people tend to go more in the jungle or in the paddy fields here and there. So, and because of the water increase in the water content everywhere, also the snakes as such or the insects, their habitats are also affected. So they come out to unusual places and cause more problems. And landslide can also happen.
Okay.
The landslides causing problems to, of course, to vehicular movement, and then to injuries also due to landslide or mudslides or flash floods, causing sudden increase in the water and the pollution also. So it can affect the water source to a village or to a colony, and in fact cause problems to the whole population who are consuming the common water source.
Okay. Yeah. So now you just mentioned about people being infected by dengue, malaria, and all those. We usually hear this kind of disease during the monsoon season. So now our viewers do know, but can you also highlight, how and what steps can we as individuals take to, the steps that we can take to prevent this kind of illnesses or diseases that can occur to us during this particular season as well?
Yes, I would say two main steps. One is to maintain our environment in such a way so as to decrease the presence or propagation of the vectors, the mosquitoes. So their common sources will be, they say, artificial collection of water. So it can be a bucket, or it can be a bowl, it can be an open tire where the rain has fallen, then water has collected. So in those places, the mosquitoes tend to thrive in those places. So if any such things are there in your house or in your surroundings, then they should be cleared, or any water collection should be covered. That is one. The other is to protect ourselves by using protective clothing. Wearing full sleeve shirts or full sleeve pants. So light colored because of the temperature, and then to prevent the skin exposure using full sleeves items. And there are mosquito repellents also can be used at home, and then mosquito nets. The government is also supplies mosquito repellent or treated insecticide treated nets for the people also. So those can also be used. So those are the common home preventive measures we can use.
Okay, sir. Can you also let us know, like, which groups of people are most susceptible to seasonal health issues and why?
Yes, the infants and young children, they are more prone to seasonal infections because of, one is lack of awareness and lack of self-care. Another is the elderly age group also. Elderly age group, because they're naturally with aging, their immune system also deteriorates. So there is one. And like we have mentioned, people with pre-existing conditions. It can be high blood pressure, it can be diabetes, it can be kidney disease, or some medications for cancer as such. Like, so those people are more prone to common infections because all the same reason, their immunity is weaker. Yeah.
And I think in addition to that, is it somehow related? But looking back into the previous years, or maybe dating back to maybe a decade or two, times have changed. The population is more. Our lifestyle has also changed. So are those also a playing factor in this diseases, or maybe children or the aged people getting more sickly with this season? Is it applicable?
Yes, definitely. Indirectly, it has implications because the more population, more crowding, so there is a higher risk of propagation for the bacteria or the germs. That is one. Another is the change in lifestyle, as in more sedentary lifestyle, and then more unhealthy dietary patterns with the changing times. So those things contribute to we call it chronic inflammation, some changes in our body which affects our immunity. They increase the risk for common problems like we have been mentioning, diabetes, hypertension, kidney problems. So indirectly, they kind of affect our tendency or vulnerability to current problems, illnesses. Yeah.
All right. Now, again, moving on to the next one here. How can caregivers and family members support vulnerable individuals during seasonal changes?
There is a challenge
Okay.
because the one is the caregivers, they have to take care of themselves in this
Yes.
current season. The other is providing clean food is very important. Hand hygiene is very important. I always even in my practice I advise the COVID advice because it has been very widely propagated, hand washing and then using face mask when going out and about, and then social distancing, which is not always applicable now. But so the common infections we get it from contaminated food, contaminated
Yes.
hands and feet. So providing food and then always maintaining washing our hands frequently while preparing food, before eating food, or after going to the bathroom. So those will be the most basic precautions.
I think, one positive thing that we got out of this COVID-19 period specifically is, inculcating the habit of washing our hands, and also,
Yes.
just like you mentioned, using mask for protection.
Yeah.
So earlier, I think what we can always observe is people always neglect those basic things, which does go a long way.
Yeah.
So thank you for that.
Sure.
Now moving on to another one. What are the typical symptoms of a seasonal illnesses and how can they be managed?
Okay. The symptoms will vary depending on the type of problems that someone may have.
Okay.
So, food poisoning due to contaminated water, it can range from vomiting or mild nausea, vomiting sensation, then stomach pain, and then loose motions and fever also.
Okay.
So there is one. The other is with insect bites or mosquito bites. Similarly, fever, headache can be very common, and we call it myalgia, muscle pain, the pain in the joints, or just general fatigue and loss of appetite. Though those can also happen in infections like dengue, malaria, and such.
Okay. Now the next one being, when should someone seek medical attention for seasonal health concerns?
For young people, children, and elderly people, or people with pre-existing conditions, it is advisable to seek help at the earliest onset of any symptoms.
Okay.
For others, mild symptoms like fever, just fever or sore throat, or just loose motion without any other problems, it can be managed at home also.
Okay.
Paracetamol, that medicine can be taken to control fever.
Okay.
Or loose motions can be controlled with diarrhea, or some commonly available over-the-counter medicines can be taken. But if symptoms are persisting despite the home treatment, then they should seek help. There is no specific criteria, or there is no specific duration of this where someone can take home care and then only after this much they seek treatment. Nothing like that. So once they feel their symptoms are worsening, then they should seek help.
Okay, I think that statement is very much important for our Naga people, especially because once we get sick, until and unless it's serious, we don't tend to visit the doctor as well.
Yeah.
So I think that goes out for our viewers as well, that we need to seek doctors' attention, or maybe doctors' advice as soon as possible, not neglecting, and not only consuming over-the-counter medicines, which we all do most of the time. So also the next question being, sir, what advice would you give to people to prevent seasonal illnesses? Like you said earlier, can you elaborate more on that as well?
Yeah, the advices are quite for at home prevention. Advices are quite limited, and they keep getting repeated over and over, because those are the most important steps. Clean food, clean hands, and then avoid water collection at home, and then avoid drinking water from open spaces or open wells. It can be from the streams or lakes. Even if during winter it was clean and you drink, during this monsoon there is more contamination of water because of extra water, so to say. So even in common open places where we drink water normally, they should be avoided. And water should, as much as possible, water should be boiled at least for 1 minute, boiling that simmering. Water should be boiled. So that is the easiest and most simplest method to prevent waterborne illnesses. And one should avoid cold food as much as possible also, or For example, you cook yesterday and bring warm meat and eat it this morning. So those things should be avoided. It should be freshly prepared.
Okay.
Home cooked food should be taken to prevent waterborne illnesses during this season.
Okay. All right. And also, how can individuals protect themselves from heat-related illnesses or monsoon-borne diseases?
Yeah, heat-related illnesses, there are certain problems can come. Very early symptoms are headache, just weakness, tiredness, vomiting sensation. So, but many people tend to ignore the symptoms, not attributing it to heat. So, the problem comes due to one is lack of hydration, lack of water intake, and then strenuous activity during the heat season. So, they say the hottest part of the day is around 10 to 11 a.m. to 3 to 4 p.m. around that range. So unfortunately, most of us work in the fields or in the open spaces around those times. So the one good thing to do is to keep getting hydrated, but not only with plain water.
Okay.
There should be little salt. You can ORS, ORS, so to say. You can make ORS at home as well. Mix a glass of water, little bit of salt, little bit of sugar, or a little bit of salt, and squeeze some lemon.
Okay.
So those things are ORS. They can prevent dehydration. They can prevent salt loss in our body. So there is one. Another is to prevent to avoid doing strenuous activities during the most hottest part of the day.
The peak hours. Okay.
Yeah, big hours. And then for waterborne illnesses, the advice will be the same. Boil water, always boil water before consuming, and make sure you wash your hands cleanly before eating or clean your foods, and then avoid cold stored food, and it'll be extended to street foods as well. It's very popular in our
yes.
Currently. So they still do with utmost effort to maintain hygiene, but some risks are always there.
Yes.
Open street food, some risk of contamination from unseen places are there. So as much as possible, try to avoid them.
Yeah, I think that message will definitely hit our viewers as well.
Yeah, unfortunately.
Also, are there any specific vaccinations or medications recommended for this particular season?
Yes, some vaccines are there.
Okay.
I forgot to mention hepatitis, but there is also waterborne illnesses. So different types of hepatitis are there. One of the most common hepatitis is type A. There are type A, B, C, D, different types are there. A is common, but it's curable also.
Type A is curable.
Yeah, to prevent that, some vaccines are available for adults as well. There is one. Another is some vaccines are also there for typhoid.
Okay.
So those can be used for the current season. Yeah.
Okay, so earlier you were mentioning about people finding a difficult time with dengue diseases, and you also mentioned that we need to cover ourselves, also keep our surroundings clear. But also we find that during this season, when people or patients are infected with dengue disease in particular, they also lose blood, or maybe we are asked to donate blood or such for transfusion or something. So can you elaborate more on that? Because like myself, many of our viewers might not be aware of the need or requirement for blood as well. What is it specifically?
Yes, thank you. Dengue is a very common issue, especially more in the lower altitude areas like Dimapur, Chimu, Nulian, and all that. More because the mosquito which causes dengue, it's more common. They thrive on those places. Less common in places like Kohima or higher altitudes. So it's a virus problem, virus infection. Most of the infections are self-limiting in the sense that it gets all right by itself. So without causing much complications. One important complication which we face is like you're mentioning about blood. Blood, there are different components of blood. We call this one of which is a platelet, which helps in clotting blood, or which helps in preventing the bleeding from increasing. So basically to stop bleeding quickly. So when that platelet level becomes very low, some people have tendency to get bleeding spontaneously also in any part of the body. So that platelet level decreases during the dengue infection. So when it goes up to a certain level, then the risk for bleeding increases a lot. So that's where we advise to give blood, but specifically platelet, the platelet component of the blood. So that's why during the dengue outbreaks, there's so much drive for blood donation and such. But it should be given very carefully, and unfortunately, I'm afraid that the public is more concerned about platelet transfusion or blood donation than what the disease actually means or requires. So most of the time, even without giving platelet, with watchful observation by the caregiver, by the doctors or the health giving team, it improves by itself again. So only in certain cases the platelet transfusion is required. Unfortunately, the transfusion is increasing because of course awareness is there, which is good, but even when it's not required, if the blood is given, then it's not a loss, but it doesn't give any benefit to the patient also. It's only a few days in the disease process that platelet becomes low. Naturally, the platelet increases to normal again. So that should be decided by the caregiver, by the doctors, and not by the public. They'll say platelet count has gone low. Why are you not giving blood? They ask like that. So those things are important issues, but the public also should know that in most cases it is not required. But it's always good to be prepared for complications, and blood donation is always in need of the hour in any time of the year. So yeah, blood donation is good, but one should not be afraid of platelets for dengue as such. Yeah.
So pressing more on the dengue section here, suppose I am infected with dengue and I am not feeling that great with fever, with all the symptoms and all. So when is it necessary for me, or what is the timeline for me to get admitted in a hospital and get the required treatment? Is there any specific timeline, or does it depend upon the symptoms of a particular person?
It depends upon the person as well. But the fourth to fifth days or after the onset of illness or fever, so to say, are the most important days. So dengue has certain stages. Initially, about 4 to 5 days, they have fever, they have headache, or just general weakness, poor appetite. But that stage can be managed at home, it can be managed at the hospital, so it's 50-50. But the next days, once the fever stops, that's when the platelet count goes down. So that is the important stage. So once you are diagnosed with dengue at any stage, in the initial or later stage, depending on the timing of the fever, it's important to at least check the platelet count, because low platelet count, many people do not have any symptoms. It can only be detected by obvious bleeding or blood tests. So if you had dengue, can be diagnosed on the first day, second day also by serology, by blood tests. So if once you are diagnosed, after 4 or 5 days of the illness, one should go and check up the platelet counts. But even if it is normal or low also, patient is the treating doctor deems fit, then it can still be managed at home as well. So yeah, no specific rule, but 4 or 5 days after the initial illness, that is the most important part.
Now, earlier you were also mentioning about insect bites, or maybe snake bites. So can you elaborate more on that, as our viewers range from various parts of Nagaland itself, and more specifically, can you let us know about the people residing in rural areas, how they can manage when they're away from public health services or maybe hospitals? There are some places in Nagaland itself where even PHCs are not available at the nearest stop. So what can an individual do when such incidents occur?
Snake bites are more common than we see in the hospitals, especially like because of the various reasons you have mentioned. Snake bites can cause various problems, from paralysis, nerve issues, to bleeding issues, and we call it the local infection, the infecting the site of bite. So all those things can be potentially dangerous, because once if they are not treated promptly, they can rapidly cause complications. So few things to be remembered if in case of a snake bite. One is, as much as possible, if they can reach a health facility, that should be always be the priority.
Okay.
And then if you can catch or kill the snake, then bring the snake as well to
Okay.
identify whether it's
Yes.
venomous or if it's non-venomous.
Okay.
So there is one. The other is to to avoid common traditional techniques. Those are which do not have any benefit, which
Okay.
delay proper treatment, and which can be more detrimental to the patient outcome also. So some people try to suck out the venom if there's at the side of the bite, so that can cause more problems. If there's a venom, so if you suck out, you can inhale you can ingest the venom, and which will cause more problems. Another is we like to tie the limb, tourniquet. So that is also not recommended, because in case of a venomous bite, if you tie a tourniquet and you go to the hospital, you go somewhere, you go home and release it, the blood will rush into the system. It can cause rapid, we call it envenomation, rapid toxins will go into the body, and someone can quickly become sick. That is one. The other is there are some traditional or some precious stones, or they bind the stones at the side of bite, believing that the stones will absorb the
venom.
Yeah, venom. So nothing like that. There's those things are, of course, some psychological effect is there, but it doesn't affect the patient outcome. Coincidentally, such cases where the patient recover with these things, it's non-venomous bites.
Okay.
So if it's venomous bites, any of those methods, they are not useful. And the other is to most of the bites happen in the limbs, because you are touching the grass leaves, so it either bite your hand or in your legs. So whichever limb it is bitten, it's best to immobilize it, to not move it.
Okay.
Because if you move it or if you massage it, it increases the blood flow in that part, and that increases the speed of envenomation. So immobilize it by you can fix a plank, or if it's a wooden stick, and fix it with a joint so that it will not move forward. If there are companions, then the companions can carry him or her by not moving that affected limb and reaching the nearest
health
facility.
Okay.
Yeah. So in case of any bite, even despite difficulties, it's best to seek nearest health facility and try avoid traditional methods. Yeah, this can be detrimental.
All right. Now, as we come towards the end, what role can you let us know that what role does public health services play in addressing seasonal health concerns?
Yeah, that is a good question. One is to maintain constant monitoring of the health or the weather forecast, if possible, the weather forecast, and the potential outbreaks, infectious outbreaks that can happen according to the population demographic. For example, Dimapur, dengue can happen. If there is flooding happens, then food poisoning, diarrhea issues can come. So the government, or so to say, the public can anticipate such problems depending on the weather forecast and prepare and make sure there's sufficient stock of medicines, there's sufficient hospital beds are ready. If the hospital is not possible to manage all the cases in case of an outbreak, a good referral system to transport or to refer the patients to the next or to the other place. Those setup should be, it's good to be prepared beforehand.
Okay. And also, are there any specific public health initiatives or campaigns that you're aware of for this season?
Specific programs currently, I'm not aware, unfortunately, because I'm not in the service also. But some from my colleagues, I've heard that there are some initiatives going on, especially related to heat-related issues. Heat syncope, they say like that, heat stroke. So severe heat injuries that can happen. So they are ensuring that every government health centers are prepared to manage such cases. So there is one I've heard of.
Okay. Now, as we're coming towards the end of the discussion, is there any message that you would like our viewers to know about and be aware and, take other precautions if necessary, apart from what we discussed?
Um, yeah, I'll still say the
Yes.
say the same things again and again, because I keep saying the same things to during my
Okay.
practice also. But the best I'll say what I'll say is prevention. Prevention is better than cure.
Yes.
So instead of going out and about getting ill and getting treated, it's best to prevent. So prevention, the preventive measures which we have discussed, will be the main message from my side.
Now, with that, our dear viewers, we come to the end of this discussion. And I hope that this has been a very insightful and meaningful one for all of our viewers watching our Doordarshan Kendra Kohima once again. And also, I would like to extend our gratitude to Dr. Vivat Lemore for being here and giving us all the required information that we need at this particular season. So, dear viewers, I hope that with this discussion, we have all learned something that we can carry on forward. And also, like Doctor said, the most basic thing being maintaining hygiene, and by washing our hands we can avoid all of the seasonal diseases caused by bacteria and whatnot, other illnesses. So that's all for now. Thank you so much for watching Doordarshan Kendra. This is Nufu Iyer signing off.